In this video, I will explain how to master level 1 exercise according to the Eudaimonia Lifestyle. For those of you who saw my diet level 1 video, you may have already noticed that the My Plate plan includes an exercise recommendation that states adults should be active at least 2.5 hours per week. While being physically active is good advice, there is a wide range of intensity when it comes to activity. Breathing in your sleep and running away from a hungry tiger are both activities, but there is a very large difference in the effort between them. In order to understand the recommendation for level 1 exercise, you must first understand the different levels of exercise effort or intensity. Let's take a closer look at exercise intensity by reviewing this chart. As you can see, there are 5 different intensity zones of exercise. These levels can be defined 2 different ways: by measuring heart rate or by rate of perceived exertion, or RPE for short. Although heart rate monitoring is more exact, I will focus on RPE because, unlike heart rate monitoring, RPE does not require extra equipment or training in exercise physiology. With RPE, all you need to do is subjectively gauge how hard your body is working. As exercise intensity increases, you will notice more and more signs of fatigue. These signs of fatigue correlate to particular zones of intensity on this chart. For instance, at light intensity, you can comfortably breathe through your nose and speak normally without feeling interrupted by the urge to breathe. You feel like you could keep this pace up for forever. At moderate intensity, you will notice that breathing through your mouth is more comfortable and feel the urge to catch your breath after completing a full sentence. You feel like you could keep this pace up for quite some time, but not forever. At high intensity, you will have to breathe through your mouth, and you can only speak a few words before having to catch your breath. You feel like you will not be able to sustain this pace for very long. In summary, light intensity is trivial, moderate intensity is challenging but comfortable, and hard intensity is challenging and uncomfortable. Now that you can identify exercise intensity zones, we can start to define the level 1 exercise recommendations. The Eudaimonia Lifestyle recommends exercise based on the scientific finding that there is a dose-dependent relationship between exercise and improved cardiovascular and metabolic health. While the perfect dosing depends on many different individual factors, the American Heart Association has made the following recommendations based on the accumulation of all of the current high-quality evidence. First of those recommendations, get at least 150 minutes per week of moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity. 2, add moderate to high intensity muscle strengthening activity on at least 2 days per week. 3, spend less time sitting. 4, gain even more benefits by being active at least 300 minutes per week. Lastly, 5, increase amount and intensity gradually over time. While I support these recommendations, the Eudaimonia Lifestyle simplifies these recommendations to just 2 primary goals in order to achieve mastery of level 1 exercise. That first goal, perform 150 minutes of moderate intensity exercise per week. Second goal, include at least 1 session of resistance training per week. Let's go through a few tips on how to achieve these 2 recommendations. Tip number 1, choose an activity you enjoy. While any form of activity performed at moderate intensity counts, exercise benefits are only seen if an activity is performed consistently over time. It is so important to pick an activity you enjoy so that your enjoyment of the activity in and of itself compels you to exercise consistently. Whether it is walking, jogging, swimming, hiking, cycling, yoga, kayaking, gardening, sports, etc., find a way to turn your passions into progress. Tip number 2, Start slow and progress gradually. It takes your body weeks to adjust to exercise, so expect gains to be slow and steady. There are no shortcuts, so a word of warning to those who think they can speed up the process by doing overzealous, hyper-intense workout. Although exercise is one of the greatest things you can do to prevent heart disease, over-exercising before your heart can adjust to a new exercise regimen can induce a heart attack. In addition to heart risks, you are also much more likely to injure yourself when you over-exercise. Please, please, please start slow and reach out to your doctor if you are unsure about the safety of your exercise plan. Tip number 3, plan out your exercise goals in advance. There are many different ways to create a weekly exercise routine, but I recommend starting out by splitting your total exercise over at least 5 days. I also recommend that you produce a physical paper copy of this plan and post it somewhere visible to keep you on track. Here is a sample plan you can use for inspiration. Link is down below in the description. Notice the patient in this plan was not able to complete all 150 minutes a week at first. In order to reach this goal, they inserted a gradual improvement goal, which is highlighted in green. By the next quarter, they were able to steadily and safely achieve their 150-minute goal. Tip number 4, don't underestimate the power of your body weight. Exercises like yoga and Tai Chi absolutely deliver a full body resistance training. Classes can be attended in person for a social experience or virtually at home, depending on your preference. If you are looking for something less formal, you can do a resistance training routine at home with minimum to no equipment. You can accomplish a very basic yet comprehensive bodyweight routine with squats, push-ups, pull-ups, glute bridges, and bird dog poses. For those of you who are not familiar with these exercises, I have placed links in the description below that review the proper form and difficulty progression of these exercises. Tip number 5, quality and form over quantity. Always start performing exercise light and right. Starting out, I would not recommend going past hard intensity for resistance training. Just like over-exercising, poor form leads to injury and lack of progress. Start with exercises where you can at least comfortably do 2 sets of 10 and gradually increase intensity from there. You can increase intensity by increasing the number of sets or the difficulty of the exercise. Tip number 6, don't be afraid to work with a professional to help build a workout program for you. A certified personal trainer, physical therapist, exercise physiologist, or sports medicine physician like me can help you build a healthy exercise program. I hope you have found this video helpful and you are able to master level 1 exercise over the next few months. In the future, I will discuss level 2 exercise, which will explore how you can use weight training, heart rate monitoring, and other advanced tools to accomplish personal goals like increasing fitness, strength, and speed. Until then, keep flourishing, y'all.